we've been able to build a very nice practice in abdominal wall reconstruction. And the patients we tend to see here are really those patients who have had multiple failed hernia operations or have what we would consider complete abdominal wall failure, where they have a massive hernia. A lot of these patients are told they can't have a procedure to fix it or it's too high risk. What we've been able to do over the past several years with our program here in Tallahassee is coordinate these operations with our local surgeons and our anesthesiologist and our hospital teams to have a very set protocol that we can bring these patients in, get them a very successful abdominal wall reconstruction, and we've really worked to minimize complications with this. So now we've built a program where we're doing several of these major abdominal wall reconstructions a month, and fortunately are having very good success. But I think a lot of that is because of how hard we've worked with preparing the patients, preparing our hospital staff, preparing our anesthesia team, preparing our nursing team, preparing our clinic staff to really handle anything that these patients would need. Typically, the patients that we're seeing for abdominal wall reconstruction have had multiple other hernia repairs, and for whatever reason, these repairs have failed. So a lot of the patients we see and we're used to seeing are having revision surgery or what we would call salvage surgery. I think we're in a very unique position in this practice in that I'm fully trained in general surgery and plastic surgery. So we're able to use the skill set that comes from both specialties to really optimize the patient's outcomes with these abdominal wall reconstructions, which can really be major operations for patients to recover from. The way our practice is set up is that our abdominal wall reconstruction patients always have a home base. So a lot of times we will see the patients every week. It's okay if the patients need to stop by and ask a question or call. The patients have full 24-hour access to me and my partners, depending on who's on call that night. Patients find that very comforting. Sometimes they don't even need us. They just like the safety blanket of knowing they can call us whenever they need anything. We're lucky that we have nurses who are very dedicated to our practice and have been here a long time as well, and are very accustomed to some of the concerns that come up with patients who do have major abdominal wall reconstructions, whether that be from adjusting pain medications or dealing with forms for taking time off of work. We have a very comprehensive program to be able to guide these patients through the entirety of the process. I think one of the other advantages we have here is that we're able to take a very individualized approach to the patient. That means a lot of times we have to go back and do research on what surgeries they've had before, look at old imaging studies that they've had, but we're really able to offer a large variety of abdominal wall reconstructive options to patients. This becomes very important to people as they are have had multiple operations to try to fix these in the past. I think patients generally feel very happy, they're very pleased with their outcomes with it, but also they feel very comfortable with it. They're very comfortable with the process and knowing that we are going through every step to make sure they get the best operation and the best outcome that they have.